'Tis the season of holiday distractions. Even so, it's important to keep an eye on your child now and throughout the year. Seems some kids will try anything for a high or buzz, and it's cause for concern. Amy Hanoian-Fontana is with us this morning. She is the Community Education Specialist for the Connecticut Poison Control Center at the UConn Health Center. Good morning, Amy.
Good morning.
You know, we've heard so much about the alcoholic energy drinks, specifically Four Loko. Supposed to be off store shelves here in the state, I believe, but that's not going to stop kids maybe from getting it out of state or having a stash maybe under their bed. So what's the concern with this drink?
So the concern with Four Loko and other drinks like it is that it has caffeine and alcohol in it. So you have caffeine, which has a stimulant effect, which revs everything up, and then you have alcohol, which has a depressant effect, which slows everything down. It's kind of like binge drinking in a can, really.
Wow. And that's not the only concern for parents, right? I mean, there's other drinks out there that are similar to this, so even if this goes, others could come in their place,
Absolutely.
Right?
There are 3 or 4 different manufacturers who make these types of drinks. And we're worried about, you know, those kind of negative effects that kids might get when they're into this kind of thing on break, or, you know, when parents are busy with parties and that kind of holiday festivities.
Okay, so take out the alcohol. Let's talk about this group right here. We've got the energy group right here, and this is also concerning for you. I mean, this includes stuff, you've got Monster, you've got Red Bull, you've got that 5-hour energy. What's the problem?
So these are all products that just have the caffeine. They don't have the alcohol in it like the previous products. And again, it gets you going. It stimulates everything. You have an increased heart rate, upset tummy, nausea, vomiting. You can even have seizures with too much caffeine. And a lot of people don't realize that a stimulant is a drug and it's not a food product. So to respect it and treat it as such and know what your kids are getting into. Where are they getting these? Are they buying them at the corner store? You know, take a look and see what they're drinking.
And are there hazards for people of all ages as well?
Yes. I mean, you know, caffeine, everyone tolerates a different amount of caffeine. Some people can tolerate more than others. The thing is to know how much you're intaking during the day and, you know how your body responds to it.
Okay. Also in the news a lot lately, this K2. It's labeled as incense, yet teens here in Connecticut, we found out, are smoking it, and the effects can be very, very harmful.
Yes, K2, also known as K3, Spice, a couple different names like that. And what it is it's kind of like an herbal incense, but they spray it. It's supposed to be sprayed with a synthetic marijuana. So something similar to marijuana, but a synthetic version. But really, you have to wonder what's in it. It's not regulated, the manufacturing's not regulated, and people are showing up in emergency rooms with symptoms that are very opposite that of marijuana. They're showing up with symptoms like having hallucinations, anxiety, seizures, nausea, vomiting, that type of thing, where you don't get those effects with marijuana.
And if all this wasn't enough, too, there's also that alcoholic whipped cream that's out there that's 18% alcohol, I believe. It's called Whipped Lightning, and there's several other names for it. But holiday parties, that's got to be a concern as well.
Yes, definitely a problem for not only little kids who may think it's just whipped cream and fooling around with it, putting it in their mouth. So it's a worry in that way. But also for adults who are maybe consuming just so much more alcohol than they are aware of or need to be. So not a good idea.
Okay, what advice can you give parents about making sure maybe their kid doesn't experiment with any of this stuff or try any of it?
Right, it's a good idea to just keep tabs on, what your kid is drinking and what they're getting into, especially on breaks and during this busy party time. I mean, these caffeine drinks are not like just having a Coke, or soda. So to really keep tabs on that and ask your kids what they're drinking and what they're experimenting, and have that open dialogue with them. That's very important.
And quickly, too, has the Poison Control Center, have you guys been fielding phone calls? Has this become a concern for parents?
We've been fielding phone calls on all of these items. Most notably, K2, we've had 40 cases since May, and nationally we've had over 2,000 cases since May. So this is a big deal.
Okay, Amy, good advice. Thanks so much. We appreciate you being here.